So good morning, everybody. Welcome. It's great to see you all today. So basically, we are going to be talking about CQC inspection in a nutshell, because there's absolutely so much to learn. But for me, I think it's important that some of the basics are just shared because we want to share good practice. We all want to do a good job and we all want to get to good or outstanding. So I'm going to give you a little bit of an introduction to myself first, just so you know a little bit about me and hopefully it'll be helpful. And at the end, you are very welcome to ask questions because it's great to have that, input. And sometimes I get asked some really tough questions. So if I don't know the answers, then one of my colleagues who works with me will be able to help. So my name's Georgina Turner. I'm the director from Inspired for Health. So my background is very varied and I'll make it brief because of the time. So I'm a registered nurse. I've been working in adult social care on and off since I was 14, started, doing the dishes in a care home. I was a cleaner. I was absolutely rubbish at it. Then I was a care assistant. Then I went on to do my nurse training. I then was a district nurse, an acute medical nurse, did some private nursing, and I looked after children on ventilators in their own homes as well. I then did my law degree and law masters and went into NHS management and quality. So, making it really brief, I also worked for the CQC as a specialist professional advisor. You might know them as SPAs. And I worked for them for about 11 years, which was really interesting. And that was within adult social care. And my key areas were governance. So it was audit, medicines management, and care planning. So really good experience. And I learned a lot, which was great. I have been working part-time with the NHS as a manager in many different roles, from risk manager, claims and litigation, but heavily based on quality and clinical governance. And I was an internal auditor for 10 years within a lot of the Northwest hospitals, which was really helpful, helping them either prepare for inspection or helping them get ready to comply with new legislation or testing them against NICE guidelines. So that was really good. And with Inspired for Health, I've been doing this part-time and now full-time for about 11 years. So everything sort of ties in like a little jigsaw. And the work I do, which I can explain later, are mock inspections, supporting registered managers either before they have their interview or helping them on their journey. So some people meet with me monthly and we have like mentoring sessions. I work with nominated individuals, help them improve the quality in their auditing, and I do a lot of training and webinars on many different topics. So welcome, and I hope that's helpful for you. If you know my background, then you can ask questions later and it might make it a bit easier for you. So I work, well, predominantly I'd say domiciliary care, supported living, care homes, nursing homes, private clinics, small private hospitals. I did look after 12 GP practices and an urgent care centre when it came to governance and compliance as well within the NHS, so it's quite varied. So you can ask away later. So I'll just skip this. Okay, so we're not going to go through all this now because you may be fully aware of this, but I'm just going to recap. So we know the single assessment framework came into place, and if you've been doing this for a while, you'll know that it made a lot of changes. And as it stands right now, we know that there's a consultation. The CQC are looking for opinions and views about what they plan to do next. And it's going to be interesting. It's not going to end until the 11th of December at 5 o'clock. And then, as you can imagine, it could be several months before they get all this information together and they decide what they're going to do. But as it stands right now, the single assessment framework is still the way we are being inspected. So I've said to all my providers, carry on with what you're doing now. Don't do any extra work, sort of don't put things into files to do with the 34 we statements, but just carry on checking your compliance, getting peer reviews, auditing, testing yourself consistently. So very quickly, with the single assessment framework, we know that it covers all service providers. we know that the regulations are of key importance. And I do separate sessions on the regulations, because when it comes down to it, as I say to all clients, focus on the CQC regulations when it comes to preparing for inspection, because that is what the registered manager legally has to meet, and they are so much easier to understand. Some people will think, oh gosh, it's law, and you'll look at it and think, oh no, it's going to be a nightmare. But once you read them, you realize that you've got this and you know it. And if you don't, it's really easy to pick up. And then you can actually explain to your team, we have to do X, Y, and Z because it meets a statutory regulation, and this is why we're doing it. Sometimes it's more helpful. So I do cover that on more in-depth sessions, especially when it comes to things like audit. So we know that the 5 key questions have not changed. Are we safe, caring, effective, responsive, and well led? We know the ratings are staying the same, thank goodness, because at least they're nice and clear. At the moment, we have quality statements, which replace the key lines of inquiry questions, which were very vast. And the quality statements are split up into we statements and I statements. I statements were used to gather patient or people feedback, and the we statements are pitched at good. They're also known as quality statements, and we have to look at them as a provider and think, do we comply with each of these statements? So I won't go in any more depth on that now, because I do that in a separate session, but I'm going to be waiting, obviously, because we want to know what's happening with the consultation, because it sounds a bit like there's going to be a 360 and we're going to be going back to similar to what we had originally, perhaps. So only time will tell. So for me, when it comes to getting ready for inspection, I could talk about this for hours. I really could. And I used to, well, still do, sessions on this in hotels and on site at providers, talking about preparing for inspection, and it's part of the mentoring that I do as well. But for me, because we only have a short amount of time, I want to give you some just tips basically that I find may help you based on all the different mock inspections and real inspections that I've done in the past. Now, just so you know, when I used to work with the CQC, I would always register a conflict of interest. So if I had to go and then do a mock inspection on a different provider, I would have to tick a box and fill out a form on the CQC's website so that they know that I could not be sent into that person or that provider to inspect them. So everything was above board, and it's really important that that always continues when it comes to people like specialist professional advisors, just so you know, in case in the future you ever come across any that you're going to work with. So going back to the slides then, we know that there are common problem areas. For me personally, without a shadow of a doubt, the regulations, which I go back to a lot, key areas are Regulation 12, safe care and treatment, which things like medicines management, risk assessment, infection prevention and control. Regulation 17, good governance, which is audits, people experience, staff experience, your values, your strategy, your statement of purpose. These are all key areas that often I see people breaching or struggling with. So when you look at the slide, audits is within Regulation 17, good governance, also known as well led, and it is often a problem area. And that's why I do separate sessions on audit. And later on this afternoon, I'm doing a mini session, like a nutshell session about audit, because it is a complicated area and there's not that much training out there, and a lot of people tend to have to learn on the job, which is not ideal. So hopefully I'll be able to give people some tips and ideas at that session. But for me, it's very important to focus on having good quality audits, conducting them regularly and with people that have experience. So again, it's a topic that I talk about separately, but just be aware CQC will be looking at your governance structure. They'll be looking at things like your meetings, your values. They'll be asking staff if they understand, your values and your mission, and they'll be looking for regular and detailed people feedback and feedback from your staff and leaders, because that partnership approach is so important. And we know that we're going to have happy staff, we're going to have happy service users. It sort of goes hand in hand. And we have to be open and transparent to learning, because we're not perfect. There's things that we learn constantly. We have to evolve, and they just want to see that we're trying our best, doing a good job, and that we are keen to learn and we are open to people's opinions, so that we can make changes as needed, and then feedback the changes to the people that have kindly give us the feedback. So that's important. So medicines management regulation 12, extremely important for me personally, and I'm sure most people excuse me, in this sector would agree. It's probably the highest risk area, because no matter what you do, no matter what systems and processes you have in place, there's always going to be human error, without a shadow of a doubt. And it is about, how do we keep our service users safe? How do we keep them involved when we can? How do we train our staff? How do we do our competency assessments? And importantly, looking at our medicines management documentation, and looking at how we audit our medicines management. And that's something that has to be done on a very regular basis. And I touch upon that within my audit sessions, because we really do focus on medicines management. So CQC will spend a lot of time looking at medicines management, and you may also have a CQC pharmacist or a specialist professional advisor that may spend a lot of time, looking through your medication cabinet, looking through various documentation, looking through your MAR charts, looking at your staff training and your competency assessments, looking at perhaps at supervisions to see if medicines management is discussed. So extremely important area to focus on. It really is. Care planning, daily logs, charts. Again, extremely important. That comes under Regulation 9. They sort of all interlink the regulations, so I'm making them sort of very simplified, but I do talk about that in other sessions. So care planning, we know there's a lot of different software out there, and it is difficult to find the right match sometimes. So my advice, choose wisely, get word of mouth. Don't just rely on a demo. A demo is great, definitely needed, but you need the word of mouth as well, and perhaps some time to play around with the system. When it comes to care planning, it's important to make sure that we are very holistic, that we are focusing on outcomes. What does the service user, what does the patient, what does the client want out of their life? And the CQC will spend a lot of time reading your care plans and matching them with other parts of your charts and documents. So if you say that you're going to weigh Mary every month, they'll be looking, have you weighed Mary every month? They'll be checking to see if there's a specific outcome or goal that your client service user has in mind, which you've worked together on. Do we have evidence of that journey within the care plan? For me, it is so important to actually discuss this journey with key workers, make sure we're on track, because the care plan should be a very important document that the appropriate family members, obviously with consent, dependent on all the different legalities, but we want to make sure that families are involved too, as appropriate, and of course that the person, the centre of it all, the person, the patient, the service user, has got good choices, and we're helping them to manage risks. There might be things that they want to do, but people have the right to make unwise decisions. So we want to make sure that people are supported to enjoy life. So make sure that your daily charts are filled out really clearly. Audit, as I'm going back to from earlier, make sure that you audit your daily logs as well as your care plans. So make sure that your daily logs match things like specialist instructions from your MAR charts, that they match specific activities that you were going to do, or you say you were going to do in your care plan. It's about it being sort of seamless, so that we can see that you say you're going to do this, you've agreed you're going to do this, and this is what you're doing, this is the progress, this is the outcome for that month. So if you've got key workers, a detailed key worker update would be great. So this is not what you have to do, but I've seen some really good ones where monthly the key worker will write an overview of that person's journey for the month. Now, I know it depends on what type of sector you're with, and it's very difficult, of course, if you're domiciliary care and you're seeing someone for half an hour a day, or not even that. But can you imagine if you're supported living or at a care home, a residential home? Technically, you'll have more time, so you can write more about their journey. And it's great with consent as appropriate. It's good to get photographs to show how people are progressing, how they're enjoying their life, and what a difference you've made to their lives. So I'm conscious of the time. If you're all okay, we'll have another 10 minutes. I do understand if any of you have to go. So we're going to quickly go through some more CQC areas of interest, and I'm going to give you some tips on some of them. Recruitment. Make sure that your recruitment policy matches what you actually do. So if your recruitment policy says you'll get 2 references, or you will do X, Y, and Z, or you'll have 2 people interviewing, etc., make sure that's what you're actually doing. I see a lot of recruitment policies where they are generic policies pulled off a software system, and they'll have lots of forms at the end of them as appendices, but they're not actually used. So of course CQC will come and inspect and think, okay, your policy says you use X, Y, and Z form, but you're using a totally different form, so you're not complying with your own procedures and policy. So important to check that. And all this comes under Regulation 9, fit and proper persons employed. So as I mentioned earlier, you really need to learn the regulations. They are very basic, very straightforward. If you need any support on that, please come back to us. We are very much open to mentoring. We help a lot of people on this topic. So let's see, autism and learning disability awareness training, extremely important. That was an amendment to Regulation 18 to do with staffing. And obviously we're very aware of the Oliver McGowan training, the Tier 1 and Tier 2. So important to make sure your staff do the appropriate training. And if you've got any questions later, after this session has stopped recording, then we can talk about that. Important to do the training, it really is. And people will often say, for example, people in private clinics or GP practices may think, oh, as in private GP practices, do my frontline staff need to have this training? Yes, they do. So the levels like Tier 1, Tier 2 depend on their role, but yes, they will need Tier 1 training. So it's important to make sure that we get the word out and people get that done. CQC will check that. It is very important. So PRN protocols, very important topic as well. As I said earlier, the CQC will spend a lot of time looking at your medicines management documentation. I know when I worked with them and on my mock inspections, I spend a lot of time on this area as well as on good governance and well led. So make sure that you've got PRN protocols in place, that they are in date, they are clear. And a quick tip, because I do a separate session on this to do with medicines management, make sure you have expected outcomes very clearly recorded. Just a tip for you. So last one on this slide, emollients and risk assessments. Please make sure that if any of your service users, clients, patients use emollients, topical medication, creams, that there is a risk assessment in place, especially if they're flammable. Now, the BNF is wonderful. You can search each one. Technically, obviously there should be warnings on the labels, but we need to have risk assessments in place. We need to tell the staff the importance, because staff may not realise on visiting families, and they may take their, a family member may take their loved one out to the pub or to a barbecue, heaven forbid, and if they were covered in emollients, there's a risk of them catching fire. Absolutely horrific, and there has been deaths, which is just absolutely heartbreaking. So we need to make sure staff know that these risk assessments are important. They're not just a tick box, that we need to make sure that the families know the risks, that obviously the service user, the patient, knows the risks, and that we make sure that everyone is complying with the risk assessment. So, as I said, I could talk about these all day, but I'm not going to because it's only a quick session. So quickly, how can we prepare? Some few more tips. Test yourself ready for inspection. It is so important. Obviously, our team do mock inspections, but you can test yourself internally as well, especially if you have several different services. You can get different managers, different team leaders to come across and test each other. Be open to objective sort of criticism and feedback, because sometimes you can walk into a service and because you work there so often, you'll be walking past something that's blatantly obviously shouldn't be there. So when I do my mocks and when I was doing my real inspections of the CQC, the walk around at the beginning was crucially important. I know if you're domiciliary care, it's different. We'll be looking at things like your environmental assessments of the service user's home. But for me, walking around the building can show me so many different things and also gives me an idea of what I need to look at in more depth. And it could be health and safety, it could be staff competency. It could be things like your rotas and how many staff you've got on duty and the skill mix. So make sure that you test yourself, that you walk around each other's service if that's appropriate. And if you need help, make sure you get objective, experienced and professional people to support you on your journey. That's important to make sure they've got experience. So for me, I've put here as well, staff involvement and preparation. Really involve your staff. Sometimes people think, oh, well, staff don't need to know about that. The frontline staff don't need to know too much about CQC, but they do, because then it takes the fear factor out of it. So I've done a lot of sessions where I've gone into care homes and I've said, look, we're going to talk about the CQC. We're going to answer your questions. We're going to let you know what it's like to be on an inspection, what things you may encounter, what you should be aware of. And we've had some really good feedback because it takes that worry out of it, because often people panic. They might go and literally hide. You know, when I've been doing the inspections, I'd be thinking, where are all the staff? Why are there no staff here? And the living rooms are empty and the service users are sat there and there's no one there. And it would be because they didn't want to be interviewed by CQC and they were worried. So if you give them the confidence, say, look, let's have a practice run. Let's ask you a few questions and we'll just have a little practice run. And anything you're stuck on, absolutely great. We're going to help you. We're going to make sure that you know you have that knowledge. You could draw on the training that you had in induction and during supervision, and that we can educate you and support you so that you are ready for this, because most staff are absolutely amazing. They're caring, they're kind, they just panic and freeze and don't know what to say when they get asked questions, which is completely normal. So anything we could do to involve them. So if you've had a CQC report that hasn't been as good as you'd like, involve them. Give them updates about what you're doing to make improvements, how you're managing of things like the press, because of course, if you are inadequate or outstanding, that's sort of the main elements that tend to get reported. Then it could be that you have found yourself in the press's limelight, and that could be very stressful and worrying for staff, and in some cases damaging for morale if it's inadequate. So it's good to reassure your staff and let them know about any reports you've had. Obviously, celebrate all your good reports and just be open to learning and to supporting each other. So very quickly, I always think it's important to keep up to date, attend any networks. For me, I don't work for them, but Skills for Care is a very good sort of font of knowledge. So their website's really helpful. And also Social Care Institute for Excellence, they have some really good information on their website. A lot of information is free. If you're a registered manager, I think you have to join Skills for Care to get extra information. But I've talked at some of their networking sessions across the Northwest, and everyone has been really nice. So definitely worth doing that if you haven't already. So for me, I always think that continuous quality improvement needs to be our goal. It really does. And what's important is to read CQC reports. I know you're all busy people. I really do get that. A registered manager and nominated individual role is not easy. But for me, I do think it makes a a big difference to read the CQC reports. Look at all of them. So as in look at, an inadequate one, an outstanding one, see what you can learn from them. Because you can look at them and think, we do that, or oh, we don't do that. We could do that. You get some really good ideas. Now, they're not perhaps as detailed as they used to be if you are rated as good. So it is helpful as well, I find, to look at older reports just for a bit more context, but be mindful though they have been tested in a different way. So I know this has been a really quick session and there's so much I could talk about, there really is. But if there's anything that you want to discuss, I'll just check if I can turn this recording off. And then what we can do is we can have a few minutes to have a chat and you can ask any questions because our team are very friendly. We've got another senior auditor, obviously got myself, we've got a pharmacist, we've got a mental health support lead. So we have lots of different people that support our team, and we have a safeguarding lead nurse as well. So if we don't know the answers to any questions, we can also ask other members of our network who are a great source of knowledge. So thank you. So I'll just see if I can stop recording this. I think I've managed to do it. Excellent. Yep.